Hi everyone, welcome to our learning experience today in the Sim Lab. Today we're going to do a pediatric simulation. It should take us about 30 minutes and then we're going to move to the transport office for our debrief, which is going to last about 20 minutes. If anyone needs to use the restrooms, they're just outside our door here on the left. Please be aware that right now we have a sign on our door to say that there's a simulation that will be taking place shortly, and we shouldn't be interrupted. I'm excited to share this learning experience with everyone today. As I'm new in this facilitator role, I will be writing things down during the sim and referring to my notes during the debrief. Laura is actually recording this session so that we can review it later for my formative assessment and evaluation. So thank you for agreeing to be filmed during this simulation. As we say, we are under Vegas rules now, so what happens in sim stays in sim. We don't chat about what happened here outside the sim lab, and we don't talk about our teammates and fellow learners. I want to share that I know you're all intelligent, smart practitioners with the best intentions to do the right thing, and I appreciate your desire to learn and improve practice here today. I also know that this environment is simulated and people don't always act as they would in normal situations outside the sim lab. And so we keep open minds. Speaking of the environment, I've done everything I can to make this as realistic as possible simulation. And I would ask you to try and act like this is real life and act how you would in your usual hospital settings. And here is what we would describe as our usual hospital room that you're working in. There is a setup with the monitors, so once the sim starts, you'll be able to get information from there. The sim doll, you're able to auscultate breath sounds in both of these areas, and the heart sounds right in the middle of the chest. Pulses can be felt in the antecubital area. The doll can cry, can mimic the breathing, show cyanosis and perfusion status. If you're unsure of what you're seeing or hearing, please just ask me. Any questions? Great. Okay, let's go ahead and do some learning. So guys, how do you think the simulation went?
I'm very frustrated. I just don't understand why the delay of the fluid resuscitation happened.
So can anyone give me a one-liner about what the simulation was about?
Well, I think it was a patient with bronchiolitis and was showing some signs of shock.
That's right. Thank you. So Jeremy, I noticed that you didn't give that fluid bolus fast enough. You know, that's a big mistake. Why didn't you do that? Don't you understand that when a baby is in shock, they need to have that fluid right away? So Jeremy, Elisa expressed some frustration. What do you think you could have done to help that baby's perfusion? So Jeremy, I observed that there was a delay in the fluid bolus being given. And I noticed and I was concerned because the baby was very tachycardic and the perfusion was poor. How do you see it?
Well, I was concerned giving fluid. So cardiomyopathy mimics bronchiolitis in kids, and fluid would harm the patient in this case. So I was waiting for Dr. Smith to assess the patient first and assess the patient's liver. And I assumed he knew all of this. I did not want to seem bossy at all.
I can understand that. So if I understand correctly, you've seen a situation like this before where the fluid did some harm?
Yes.
Okay, and you did not want to speak up and seem bossy to Dr. Smith?
That's right.
Well, Jeremy, that is a very interesting perspective. And has anyone else felt or experienced feeling like this before?
I think so, but I think when you're dealing with a PAL situation, it's important that everybody speaks up and voice what their thoughts are.
Yeah, that's right, Elisa. When we take our PALS course, I think we're all encouraged to speak whatever's going on in our head because we're one team. So Jeremy, how might you manage this situation in the future?
I guess I should be speaking up when I have a thought about something. It'd be to improve the best outcome for the patient.
Excellent.